Well, thank you, Congresswoman and Chairwoman Eshoo. And I know not only this is an important hearing, but this is something that you care very much about. And I hope I'm not missing anybody, but I just wanted to say that I really appreciate the input from all the Congress people that represent the territories. I mean, I just have to say, Congressman Sablon has been, I don't think a day goes by without him mentioning this issue to me. And certainly when I think it was in the aftermath of Hurricane Maria, I don't know, we've had so many hurricanes that I can't even remember the name of it, but I think it was Maria. When we went down to the Virgin Islands with Congresswoman Plaskett and with with Jennifer, with Congresswoman Gonzalez, and they were talking about this, the whole time, how we need a permanent solution. This just can't be done, by kicking the can down the road. And of course, ever since he's been elected, Congressman Sid Nicholas has been talking to me about it as well. In addition to that, you have, members like Congressman Soto on our committee and Congresswoman Velasquez, who are of Puerto Rican descent, who constantly bring this to our attention and want solutions. So, look, all of you have been so helpful, and so I'm glad that we're having this hearing today, and all of you have an opportunity to express your views. It wasn't that long ago that we had our last hearing on how disastrous it would be for Medicaid funding in the territories to collapse. And I was proud that we were able to work together on a strong bipartisan bill that combined critical increases to the territories' funding and federal medical assistance with FMAP, for program integrity improvements. But look, we know that Medicaid in the territories has been chronically underfunded for decades. The consequences of this inequity can be seen in the crumbling health infrastructure, emergency restrictions on provider networks, the failure to offer coverage of certain life-saving drugs, and even the debt crisis in Puerto Rico. Years of inadequate Medicaid block grants have forced the territories to divert more of their own dollars to ensure the residents have received the care that they need. And this funding structure has forced the territories to pay more than their fair share for Medicaid, much more than they would have to pay if they were treated like states. Last Congress, the committee passed legislation that would have provided several years of increased funding and a higher FMAP to all the territories. Thanks to the leadership of Representative Soto and Bilirakis, we were able to find common ground on this legislation. Unfortunately, I was very disappointed that at the last minute, former President Trump refused to support our bipartisan bicameral agreement and insisted at the last minute on reducing that long-term solution to 2 years. And because of that, we're now once again on the verge of another crisis. I believe the stakes are too high. The consequences of inaction are too tragic to continue down a path of short-term fixes. The territories need a permanent solution to their Medicaid funding shortfalls. They need a solution that ensures that they can make improvements to their programs with certainty and that the increased funds they're relying on will be there for more than a couple of years. Beneficiaries need certainty about the services they critically need and rely on, and permanent improvements to these critical programs and to the health of beneficiaries can only be expected if Congress guarantees permanent, adequate funding. So I'm glad our colleagues from the territories could be here today to share their perspectives. I know that bipartisan committee staff recently met with health officials from the territories, and we have also received statements for the record from all the territories. In just over 6 months, the territories will face a catastrophic loss of federal Medicaid funding that will jeopardize access to care. Long before that, the territories will have to begin the process of contingency planning to make the cuts necessary to address this looming fiscal cliff. And this would include limiting reimbursements to providers, reversing expansions of eligibility that provided thousands of residents with access to Medicaid for the first time, and ending coverage of life-saving medications. But we can't allow this to happen. We just can't allow this to happen. So bipartisan members of this committee fought hard last Congress to secure additional Medicaid funding. With that funding, they've made tremendous progress, but that progress will be lost if we don't act quickly. So we're going to act. We want a permanent solution. We don't want to kick the can down the road. But thank you again for being here, and thank you, Chairwoman Eshoo, for having this hearing and for all the concern that you have expressed and leadership on this issue. I yield back. Thank you.